Hi, my name's Emma Squire and I recently completed the Environment and Human Health Masters based at the Centre. Yay! Today I'm going to talk to you about my dissertation project, which looked at nature connectedness and exposure to blue spaces. The idea for this project came about whilst I was working on the Horizon 2020 funded Blue Health project. From previous research, we know that exposure to blue spaces, measured in this instance as residential proximity and visits, and being psychologically connected to nature, can have positive effects on human health and well-being. In detriment to this, however, living further away from blue spaces decreases the likelihood of visiting these aquatic environments. Therefore, my study set out to investigate how being connected to nature could overcome this barrier of physical distance by asking the question, how does nature connectedness moderate the relationship between an individual's residential proximity to blue spaces and frequency of visits to blue environments? The Blue Health International Survey was chosen as the most appropriate secondary dataset available to answer the research question. The focus of this survey was to investigate recreational use of blue spaces and its relationship with human health. It was carried out online with a representative sample from 14 different EU countries in 4 waves. To answer the research question, I carried out a logistic regression analysis in 4 stages. I described the unadjusted relationship between residential proximity and visit frequency, controlled for demographics and country level effects, explored the relationship between nature connectedness and visit frequency, and investigated nature connectedness as a moderator. As predicted, I found that respondents living nearer blue spaces were more likely to visit at least weekly compared to those living further away. I also found that respondents with higher nature connectedness were more likely to visit blue spaces at least weekly compared to those with lower nature connectedness. However, when the interaction is added, I found that high nature connectedness versus low nature connectedness positively related to visits, but only for those living within 5 kilometres of the coast or 2.5 of rivers. This suggests that higher nature connectedness is not enough to overcome the barriers to visiting blue spaces for people who live further away, and that other factors such as financial resources are likely to have an influence. Nature connectedness is therefore an important consideration for increasing access to blue spaces, with potential subsequent positive impacts of health and well-being, especially for those living closest and who report greater difficulty in accessing them for recreation. Overall, this study highlights the need to consider nature connectedness in future theory and research for blue health across Europe. I'd like to take this opportunity to thank my supervisors and the Blue Health team and staff at the Centre who supported and encouraged me throughout my Masters. I'm now available to take any questions. Thank you.